A new bill has domestic violence prevention advocates concerned for kids. It would require teens to receive parental consent in order to access emergency mental health support.
Columbus Bureau reporter Morgan Trout tells us that supporters say it is about transparency, but opponents argue it could cause more abuse to go undetected.
988 Suicide and Crisis Lifeline.
Some of the most heinous crimes with the most vulnerable victims.
I've responded to child sexual abuse victims at 2 a.m. in the hospital. I've held their hand throughout the night.
Emily Gamar with the Ohio Alliance to End Sexual Violence reports that thousands of children are sexually abused per year. State data shows that the majority of all reported sexual assaults happen to children under 18. But Gamar says that many cases go unreported.
It takes some time to build trust with that counselor to allow for a setting where somebody feels like they can disclose what's happened to them.
And she was thrilled when Governor Mike DeWine expanded his crisis mental health program. When a child calls the 988 hotline, they get emergency access to support, free of charge. The program also lets teens 14 and older get temporary help, including 6 weeks of counseling without consent from a parent or guardian. Gamar says that that's important in sex abuse cases.
Anywhere from 35% to 93% of child victims, one, knew their perpetrator, and two, that perpetrator was a parent or caregiver.
But grandfather and conservative activist John Stover says that the program keeps families in the dark.
There is no situation whereby a parent should not be notified that their 14-year-old is dealing with mental health issues.
And some state lawmakers agree with him. House Bill 172 would require parental approval for minors to get the temporary support. This bill is meant to mirror language from last General Assembly's House Bill 8, legislation requiring schools to notify parents if the child identifies as LGBTQ+, or if they have a mental health issue.
You cannot have two unique programs whereby parents are notified under one circumstance if it's in the school, and they're not notified if it's another circumstance outside the school.
Stover says the bill wouldn't stop abusers from being caught. He says mandatory reporting requirements would go into effect. Counselors would have to tell police, and they would investigate the parents.
There is no argument there.
But Gamar warns that cases don't always work like that.
If a 14-year-old is being raped by a parent, they would have to ask the parent who is raping them for consent to go see a clinician.
She says if the bill becomes law, that is a door closed for teens to be able to safely seek help. At the Ohio State House, I'm Morgan Trout reporting.
And we always want to remind you that if you or someone you know is facing a mental health struggle or just need someone to talk with, dial 988. That's the Suicide and Crisis Hotline. Counselors are available 24/7.